is basically a broad term, just like regenerative medicine. So
Sure.
what it is basically what different type of modalities can I use to actually help with the healing process. So for example, if I use PRP, that's basically platelet-rich plasma. So there's basically we take your blood, spin it down, concentrate the growth factors in platelets, and try to help with the concentration of the growth factors there. So we promote a healing response. So that's where that is the idea behind it.
Hello, listeners. Welcome to another show of Doc Talk Live Season 7. I'm your host, Dr. Samir Nangia, and I'm excited for another wonderful show for all of you guys. Just a reminder, Doc Talk Live is a health show dedicated to educating its listeners about different health topics every week. We do so by bringing on medical experts from the community, and we ask common questions for you guys to learn. Be sure to send in your questions through Facebook Live if you're watching, and you can find more information about the show on all of our different platforms, which include Facebook, Instagram, Twitter, YouTube, and our website, doctalklive.com. That's DOCTALK live.com. And also check out our episodes on our podcast platforms such as Spotify, iTunes, and iHeartRadio. Again, my name is Dr. Samir Nangia, and I'm excited about having this great show for you guys today. I'm joined by Dr. Nudie from DFW Sports Medicine, and I'm very excited about today's topic on regenerative medicine and orthobiologics. So I know that sounds very foreign, but we will learn a lot today on our show about that. Welcome, Dr. Nudie. Thank you so much for volunteering your time. Maybe we can start out by having you tell us a little bit about yourself to our listeners.
Thank you, Samir. Welcome, everybody. And my name is Dr. Ratna Nuti. I am a sports medicine specialist at DFW Sports Medicine. My background is that I have board certification in both family medicine and sports medicine, but primarily focus on sports medicine type of in not only injuries but prevention, as well as musculoskeletal type of issues as well.
Well, it's always a pleasure to have you. I think this is the third time you've been on our show over the last 7 years, so I just wanted to thank you so much again for joining us on this important topic for our listeners. And I'm actually very excited about this because my kids play sports competitively, and so I'm very anxious to learn as well. So why don't we start out by asking what types of conditions are treated by sports medicine physicians? When would someone come see you in clinic?
Yeah, that's a great question. Very commonly asked as well by majority of the people. I've had a lot of patients ask me, why would I come see you compared to like my primary care or even orthopedic surgeons? So a sports medicine physician will see any type of musculoskeletal type of injuries. Some will also even see some acute primary care type of stuff as well, like such as rashes, like UTIs, or even hey, I can't get in to see my primary care, so can you please do a medication refill temporarily? So there are some little niches here and there, but for the most part, what we focus on is musculoskeletal. So what that means is like muscle injuries, tendon injuries, ligament injuries, even joints. So those are types of things. We try to do it in a non-operative, meaning anything that does not involve surgery, as
Sure.
long as you're a candidate for it.
So I know a lot of our listeners have family members who play sports. So what are some of the common sports injuries that you see?
Yeah, so it really depends on the sport that your kid is playing. So, for example, if they play tennis, you're going to see a lot of elbow type of injuries or even shoulder injuries. If your kid plays football, I mean, you'll have concussions or even knee injuries in terms of ACLs, as well as ankle sprains as well. So really depends on the sport that they're playing. So, but for the most part, even dancers are considered, athletes or athletic. So they'll have foot and ankle type of injuries, especially when they're on their feet a lot and practicing so many different hours and different types of dance. So it really depends on the sport, and that's why we commonly ask, what sport do you play? What level are you at? So these are things that we try to dissect when you come in.
Oh, thanks. That's a great answer. So, for speaking as a parent of some kids who play sports, what are some things that we can do to kind of prevent injuries from happening?
Yeah, so one is to keep an eye on how much is your kid training. So for example, it's not just training for the sport, but also outside of training. So are they spending more time at the gym? Are they actually playing more, say, for example, if your kid is a quarterback, is he spending more time playing football with his friends rather than, mixing it up and changing things? So you really want to pay attention to that because the hours add up. People don't really realize that until after an injury happens. So these are things, if you can prevent those things kind of happening, your body needs rest. So just making sure you have adequate rest periods is also very important.
Yeah, like some kids they or people play sports year round versus seasonal, so that's kind of where overuse can also lead to injuries as
Most
well.
definitely, and yeah, we don't really recommend year-round type of sports. You definitely want to make sure you have some months where you're off, and also different sports that you are involved in. So not playing the one thing over and over again. It's going to be very important.
Yeah, something I don't do often is, after working out, like stretching or before and after. Has
Mm-hmm.
that shown to be beneficial?
So stretching is a little debatable because people commonly think just because they stretch before exercises that it prevents. Not necessarily, but it's a good way to actually keep yourself nice and flexible and limber, and it's also very important as well. So we do recommend that, but it not necessarily means you're going to prevent an injury itself.
Sure, sure. And if you think you sprained your ankle, which just seems to be a common thing,
Yeah.
is there anything you recommend doing right away at
Yeah.
home remedies until you can get in to see you, obviously, in
Yeah,
clinic?
sure, definitely. So, for example, resting it, icing it, making sure you compress, protecting it, maybe wearing a brace temporarily, just so you have some kind of protection there, as well as elevating it. So, for example, if you have an ankle sprain, most times than not, you're going to have all the swelling kind of pull down. So, you want to be able to elevate your leg so that way when you wake up the next day, you're not seeing a big, nice, big, puffy ankle and then getting worried about that.
Yeah, I remember that growing up playing sports. So for those who are just joining us, we're live in the studio with Dr. Nudie, sports medicine. She has a solo practice, DFW Sports Medicine, here in the Dallas-Fort Worth area, and we're excited to talk about regenerative medicine and orthobiologics. So why don't we dive into regenerative medicine? What is that? That seems like a foreign word to me as well.
Right. So the concept of regenerative medicine is that you're basically trying to, bring in new technologies, new types of therapies to enhance a healing process or to help with pain. So that's the idea behind it. Commonly, there's different types of regenerative medicine. So for example, like PRP or platelet rich plasma, and we can get a little more into this as we talk about it, as well as what many people know as stem cells, or getting it from your bone marrow or amniotic type of tissue, or even fat. So there's different types of modalities for it, and but the concept behind it is ultimately, helping you deal with the pain that you have, and you're not a surgical candidate.
Yeah, I get a lot of patients who ask me about that. And the first question that they ask me, do you think I'd qualify for that?
Right.
So what are like some scenarios you may use that?
Right. So one most common one is the patient absolutely refuses to have surgery. Then we can talk about that. First things first, I always counsel patients. Unfortunately, there's a lot of scam out there. So where if you have any advertisements basically saying, hey, your shoulder is gonna look 20 years younger, or you're gonna have a shoulder of a 20-year-old, please don't believe that. Please do your research, because the idea behind it is to minimize your pain and help with the healing, but not necessarily to reverse what you already have. So that's the most common misconception there. So someone who could be a candidate, they're not a surgical candidate. So surgery is not an option for them. This is something to try. Or they want to exhaust all their options before they even consider surgery, then this is potentially something as well. But please be sure to actually do, evidence-based type of therapies, for example, like doing your physical therapy, doing what your doctor recommends if you're a candidate for a steroid injection and such, before you consider these kinds of things, because it's not covered by insurance and it's definitely expensive.
Sure, sure. Thanks for bringing that up. So let's go a little bit into orthobiologics. What are those, first of all, and what are the different types?
So orthobiologics is basically a broad term, just like regenerative medicine. So
Sure.
what it is basically what different type of modalities can I use to actually help with the healing process. So for example, if I use PRP, that's basically platelet-rich plasma. So there's basically we take your blood, spin it down, concentrate the growth factors in platelets, and try to help with the concentration of the growth factors there. So we promote a healing response. So that's where that is the idea behind it. Same idea with stem cells, typically speaking, especially bone marrow. So that same process that PRP undergoes, so does bone marrow. Now for amniotic, some companies will get either amniotic tissue or they get the dehydrated version of it, and your physician may have to mix it with, say, like sterile saline and inject it. So different components. Basically, the idea is it comes from placental tissue. Um, some people culturally have some different beliefs behind it, but not necessarily. It's from different means, and it's a purified process usually that the company does, not the physician. And then, of course, fat is basically harvesting fat from either your trunk or your flanks, and then people ask if this is something similar to liposuction. The idea and concept is that, but the idea is not that we're trying to take fat out of you and contour you, but rather we're trying to grab some stem cells and purify the fat before injecting it into the area.
So, is there one better than the other, or is there evidence on one versus the other?
So evidence is ongoing. So there's not a lot of evidence for most of these modalities, but one of the evidence that we have seen is with PRP and osteoarthritis. So there have been good level 1 type of studies, meaning robust studies that are have been studied where they have found benefit of using PRP for knee osteoarthritis. Now there are ongoing research for other modalities like stem cells, even different modalities of stem cells, and as well as using PRP for different joints and tendons. But evidence of like 100% this is going to work, no, there's not that. But is there promising evidence? Yes, there is promises.
Sure, sure. And I have a lot of patients, in my kidney clinic who are not surgical candidates. So
Right.
they have definitely undergone some of these therapies, and some have found a benefit from it. So thank you for going over that, because it is a commonly asked question around medical offices.
Definitely.
So you mentioned earlier platelet-rich plasma treatment. So can you maybe talk a little bit more about that and how that works? Is that kind of the first line of orthobiologics?
So not necessarily, but it can be a cheaper option of the orthobiologics. So if you look at cost wise, sometimes that can be a cheaper option compared to other options, just because it's the processing, or the kits are expensive because to harvest these things. So that's where that comes into play. So typically we do start off with PRP, not necessarily it's the first go-to, but maybe because it's a little easier on the financial books for patients. So that's where PRP comes into play on that.
So let's say I'm a patient, I come into your office, you think I'm a good candidate for this. So what does the treatment look like? Is it just one shot, or or is it more than that?
So really what we try to do is basically say, let's try one shot, see how you respond. So before we even have you come in for the procedure, typically we ask that you stop all anti-inflammatories. So typically like Aleve, ibuprofen, things like that. Not necessarily Tylenol, we're okay with that. Just because it kind of kills off the growth factors a little bit because
Sure.
it's anti-inflammatory. But we ask you to stop that before the procedure, and then also after the procedure for like a couple weeks or so. And then every physician has different protocols that they like to follow, but typically if it's a joint, you go back the next day or the same day back to work. If it's like a tendon and they had something more invasive to do, then that's when we say, okay, maybe you need to take some time off, like maybe a couple weeks or so. But that's a discussion between you and your physician. But
So you can see results right away
almost right away, but it's not immediate. So I tell patients it's not the magic wand. I wish I did have that, but definitely within, at least I would say giving it a couple weeks to a month is reasonable time frame. And if you need to repeat the injection, you can. Now that being said, we have seen evidence and really good level, strong, robust studies saying that for knee osteoarthritis, having 3 rounds of like the PRP injections
Sure.
that are roughly a week apart can be beneficial. So, and augments the effect. So, but other than that, usually I go injection by injection before, because again, it's a financial investment as well.
Sure, sure. And could you go like 6 months without one and then get one
You
and then a
can.
year?
Yeah, there's not a time frame where it would be contraindicated per se to say, oh, you just got it last week, you can't get it this week. But it's just, would you really need it this week? Maybe not. Maybe you can space it out a little bit better.
So now that we have some listeners who are really interested about this, they're probably thinking, can my condition be treated by PRP therapy?
Right.
So what are some common conditions? You mentioned osteoarthritis. Is there
Mhm.
any other things that you treat it with?
Yeah, so tendon injuries is one. So if you have tendinosis or really chronic injury use from repetitive injury to the tendon, one of the modalities that I do is doing like a 10x procedure where you go in, kind of debride the injured area, and then add in the PRP to stimulate a healing response. I tell patients I don't grow back the tendon, but however, it's to help with the pain response of it. So that's something that you can treat. So that's another common one. Other common one being like tennis elbow. A lot of people will say, hey, that tendon, it's just driving me crazy. I can't even hold my racket and make my serves like I used to. So something to even consider for that too.
Sure, sure. So moving from PRP to something that's more trendy, at least when I hear from patients, stem cell therapy. So how is that different from PRP?
Sure. So PRP, as I mentioned, it was more about platelets, right? So stem cells, there's 3 different modalities, like I mentioned. So bone marrow, concentrating the bone marrow aspirate itself, fat, really grabbing as much stem cells as possible, either in your flank or your stomach, wherever there's more fat tissue available. And amniotic being like a little more controlled in the sense that each company has a certain X amount of factors. So the thing is, when I tell patients what they're trying to decide, should I get an amniotic stem cell injection versus like a PRP, I tell them with PRP, everyone's blood levels are different. So my blood is different from your blood, Samir.
Mhm.
So, but with amniotic, a company will standardize it so you know the exact amount that is going in there. So, and if the company doesn't reveal, maybe you should take a step back for sure.
So is this our, I'm sure a lot of listeners are wondering too, is this your own fat cells or your own bone marrow, or is this
Yeah.
coming from someone else?
So when it comes to bone marrow, it's definitely your own.
Okay.
When it comes to fat, it's definitely your own. When it comes to amniotic, it's definitely
Yeah.
not your own. So, but
So do you get, as a sports medicine doctor, do you do that, or is that?
I do those.
Okay,
Yes.
okay. So
I
you
do
do
offer
those.
those therapy options. Yes.
Oh wow! So you would go in and you would get the bone marrow,
Yeah.
and then you'd come in the next time to get it injected, or how does
No,
it work?
you basically, it's all in the same day procedure. So if you are a candidate for bone marrow, so one of the things I would like to mention is when it comes to bone marrow, if you're a cancer patient or a cancer patient who's recovering or a certain age,
Mhm.
probably not a good idea for bone marrow just because your reserves are less. But if you are a candidate, then yeah, we extract the bone marrow that same day, spin it down, concentrate it, and inject it into wherever we have discussed.
Wow, that's great. So what's the recovery period for this kind of procedure?
Yeah, so honestly, when it comes to joints, joints are able to tolerate it a little bit better. So we just say, hey, take it easy for the next 48 hours. Don't go just because you feel great to go run a marathon or so. But so you can go back to work the same day. If you feel like you need one more day off, that's fine. Depends on patients. But when it comes to stem cells, you might want to take especially if it's bone marrow fat. Some people will take at least a few days, not long, maybe 48 hours or so. But if it's a tendon that we have debrided and done it, depending on what body location, we may have to keep you on crutches or actually tell you to relax for the next couple weeks. So it really does depend.
And then you mentioned this earlier. I think you kind of mentioned it. So is this all FDA approved? I know you said cost-wise it may not be covered, but is it FDA approved? So that's where it gets a little tricky and murky, and this is where physicians have to be super careful. So
when it comes to FDA approval, you need to know where in the stage of FDA approval they are. So everyone can easily say, hey, we're FDA approved. So for the most part, PRP, bone marrow, and as well as fat have gotten to certain levels on the FDA approval scale. Amniotic, you have to be really careful of which companies, because if you as a physician did not know where it is in the process, then guess what? You are on the hook for it. So knowing the FDA process of clearance and where they are and what, and really investigating what those companies are saying is very important and key, especially to protect our own patients.
Sure. Is one cheaper than the other compared to all these like marrow, amniotic, or
Yeah.
stem cell? Or
So for the most part, you can generally say that bone marrow, amniotic, and fat are pretty on the pricey side. And PRP is quote unquote cheaper, not that it's any less expensive, but definitely on the cheaper side of things.
Great. For those who are just tuning in, we're live in studios with Dr. Nudie, sports medicine, DFW Sports Medicine, and we're talking regenerative medicine and orthobiologics. Well, I've learned a lot here in the last 30 minutes. I know we're running short on time, but I have a few more questions if we can squeeze in here. How long do the results of these various therapies last? We kind of touched on it, but I wanted to formally ask that question.
Yeah, so it really depends on every person's body. So to promise even a year is a little difficult. Some people will drag it to a year, some people may not. But everyone's body responses are different, so it's hard to say. But that's why I take it really injection by case basis, because first of all, if it didn't work for you, I'm not going to offer it again. I think that's not ethical to do, but definitely, if we can at least try to get a year, that's a great marker. But if we can't, then, that's just your body's response, and that's what we're limited to.
So, is the price dependent on the dose amount, or is it just the one standard price for everybody?
It's usually typically a one standard price, but it just depends on the amount of injection. So suppose if you require 2 injections, then you're paying per injection. So a lot of these are per injection pricing dosing, but not necessarily per dose. Like if I get 3 mLs of PRP, it's the same thing as getting 7 mLs of PRP. But it's not necessarily that, but if I did it all in one injection, then that's pretty much what it comes down to.
Oh, great. And so just to give our listeners a rough price, how much does something like this cost on average? I know there's a lot of fluctuations and things like that.
There's a lot of ranges, but you can at least approximate, at least for PRP, approximately $1,000, plus or minus on that. Some places have done it less than that. Some people have done it more than that. So it's not a bad idea to shop around. I tell patients all the time, please go take a look. But also know what kind of products they're getting inside their body. I think it's very important to know.
Oh, absolutely. Absolutely. And like you said, you can do as many injections as you need, and you can space them out as much as you need to.
Right.
Okay.
Exactly.
And the most important question, what are the side effects?
Oh, that's a great question. So side effects, with any injection, there's always, pain from the needle stick. There's always risk for bleeding. There's always risk for, if you have a minor nerve that kind of goes there, a little bit of numbness, tingling there. But, and of course, like inflaming the joint itself or the tendon, there's always those risks involved. Anytime you're sticking a needle from the outside world and inside, a risk for infection, but we always try to minimize those risks. But side effects wise, as long as it's your own body, not really.
Well, that's great. That's great. And we have about a minute left. If you can tell our listeners again where they can find you and look you up social media.
Sure.
I'm sure a lot of our listeners are interested now that they have some knowledge about it. So
definitely. Yeah, I can be found at DFW Sports Medicine. Our website is www.dfwsportsmed.com, and our office number is 469-430-9380. We're on Facebook as well as Instagram, same company name, DFW Sports Medicine. If you want to follow me as a physician, I do have my own professional Facebook page, just Rathnaniti MD, and on Instagram, I'm SportsMed MD. So there you go.
Well, thank you, Dr. Nudie, for being on our show, being a regular, and always being so great and volunteering your time to educate our listeners all across the world. And it's been an honor to have you again, and I keep learning from you every time you're here.
No, thank you for your time.
And thank you to all our listeners for listening to another episode of Doc Talk Live Season 7. We have some great shows coming up the rest of the season for you. Again, check us out on all our social media platforms, our podcast platforms, and our website, doctalklive.com. It's truly been an honor to be here with you. We got 30 seconds left. Anything last you want to say? Any advice for all the patients out there listening?
Yes, definitely do your research for sure. A very important thing. And if something sounds too good to be true, just be cautious.
And thank you. That's very important. It's great hearing that from a doctor.
Yeah.
Well, stay healthy, everyone, and tune in next week for another great show. Thank you.
Thank you.